be distributed across the country, closer to borders and places where we have heavy populations to soak pressure if there should be another infectious disease. In the process, we are going to utilize some of these funds to support our creation or establishment of the infectious disease centers to do our CDC in Ghana, to make our healthcare system a bit complementary with what support that we can get if we should have infections any longer. Gentlemen of the press, directors, I think I've spoken enough on infrastructure, and I want to end my talk here. And the next time we may talk about some other successes. But I thank you very much for granting me audience, and the Minister of Information, Minister and the Deputy Minister, giving me this platform to showcase what we have in the ministry. I will leave the podium, and I will allow my directors with their indulgence to support me, so that questions come, directors to prepare to answer those that you can pick to answer. Thank you very much.
Thank you, Honorable Minister, for the insightful presentation. In fact, I'm overwhelmed by the number of hospital projects that we've started and the number of hospital projects that we've completed. I believe that story ought to be told, and today is the starting point of retelling what has actually been done in terms of hospital infrastructure in the country. And you know, quite recently, about a week ago, I noticed that some story was trending on social media about government taking 430 million USD for COVID, and nothing has been done with that money. Where is the money? They were hiding it. What have they used the money for? To know that we have 15 treatment centers underway, and that we've been able to acquire PPEs, equipment, sanitizers, medical materials, and vaccines, among others, and even medicines, is to tell you that there is no way government is going to take the resources that belongs to the good people of Ghana and just use it without thinking about the Ghanaian. So in fact, there's been judicious use of whatever resources were allocated to government for COVID alleviation program. And I would like to thank the Honorable Minister for that. And most importantly, one thing I took from the minister's presentation is the fact that the whole world, not just Africa, Ghana is one of 2 countries that got the story right. Ghana did better in fighting COVID than even the United States of America and Great Britain. So when we talk about the system, it should tell you that our health workers, our technocrats, our directors, the good people we have in this country who have the know really doing well to help us alleviate COVID in this country, and we are doing our best. So without taking much time, we will come for your questions. We will take the questions in 3 batches. We will take the first set of questions. 4 people, you can ask maximum 2 questions and nothing more. And then we'll go to the Honorable Minister for his responses and then come back to you. So we'll take question 1, 2 from Nana. Okay, I'll take the lady and also and you. So we'll take the first one and we'll come back to you later. So please, your name, media house, and then you ask your question.
All right, my name is Samuel.
Please, who has the microphone?
Thank you. My name is Samuel Mbura. I am with Joy News. I'm really excited about the presentation that the Honorable Minister gave us on the fight against COVID-19. Quickly, I want to find out, he was made mention of the fact that the Fix the Country movement could have exercised some restraint and focus on the success government chalked in the fight against the COVID, other than the isolated cases of accountability. Is he saying that the Fix the Country movement call was unfair to government, or they could have restrained some patients? The second question has to do with the beautiful story he has given us on the status of the fight against COVID-19 so far, is it not possible he appears before the public committee, accounts committee in Parliament, to also tell them the same story he's telling us as the media, because he has been invited and we've not had any response from him yet. Some members of the Public Accounts Committee are not.
Okay, we'll take the second question.
Good morning, Honorable Minister.
Good morning.
You did touch on so many issues in the health sector. We did not expatiate on the Agenda 111 because that involves some mental hospitals that the government has decided to put up in this country to tackle that problem. I don't know whether you have a special day that you are expatiating on it. And then my second question, if you look at Nkoko, for instance, we are being said by a mission hospital, Nkoko Mission Hospital, I've forgotten the name anyway. But those in the environs, if they want to access healthcare, they go to, on the top of the scap, a TB hospital that is being expanded. So has the government has any plan so far to put up a hospital at Nkoko to serve the environs down the scap?
Thank you. So we'll take the third question from the...
Good morning. My name is Linda from Ghana News Agency. I would like to thank the Minister for that beautiful presentation. And from your presentation, you mentioned that COVID-19 has come to stay with us. Amidst COVID-19, which is a pandemic, epidemics too have broken out. I want to know if there's a plan to have a kind of fund to support such health emergencies in the country as and when they come about, so that we can limit the number of borrowings that we do. And then secondly, on infrastructure, when you look at the UHC roadmap 2020-2030, we have under it the establishment of infirmaries at workplaces to serve its employees and market centers as well. I would like to know if we have started this process and how far we have gone.
Thank you for the question. So we'll take...
Good morning, Honorable. Midin de Yakokraba, Kasapa FM. Said now Oma breakdown.
Kasapa FM.
Yes. Oma breakdown on the government of Ghana COVID-19 expenditure. My person says this should be the total amount you spend so far in the COVID-19 expenditure. And I think so. Best also bit me my update on the government COVID-19 trust fund, and also bit me my update in the budget. And then finally, when is government touching on the KNUST teaching hospital? My understanding is that it has been abandoned for the past 7 years. And Sisi Anthony, I heard him say, a bunch of to me, Edin and Sako Kanafi, why you home BB, and so what many budget from saying. The KNUST teaching hospital.
Okay, so we'll go to the Honorable Minister for his responses and then come back to you.
Thank you very much. I dreamt there was going to be a question agenda 111. And I didn't include it in my slides, but I invited somebody who is working under the supervision of the Chief of Staff, because this is a very big flagship program situated under the President's own eye. And a small group has been formed, Health Infrastructure Group. The coordinator is here, and I think I want him to brief you on what is happening there. They give me reports, and we collaborate with them. So I can tell you what it is, but it's good to come from Isomat. So Kwabra, wait, after my responses, you can come and then just give us some small insight into where we are with Agenda 111. A young woman from Joy who asked about Fix the Country campaign was unfair. I think I told exactly what I wanted to tell you, that they should have hesitated a little bit and looked at evaluating other countries and how COVID had damaged economies. And Ghana could not be an exception. So what is happening in our country of hardships, it's not any man's doing. It's something exogenous that mankind has no control over. So if China could close down shops, could close down factories, could lock down people inside, and they're not producing, how will it impact on Ghanaian economy? If the US cannot export, how will it impact on Ghanaian economy? That is why I said that we should hesitate. Somebody is asking for the full extent of expenditures we made in COVID. The Deputy Minister has mentioned just one aspect. Yesterday, I was with the World Bank Regional President for Africa. So far, World Bank alone, we borrowed $430 million. I'm not in the finance ministry yet, and I don't intend even going there. I can't go there. But I can't preempt the finance minister's numbers. We need to sit down and do some work. So what we have in health is what I come up with. The Deputy Minister was talking about things that we use some of the monies for. It's phenomenal. We haven't even quantified how much we spent on water and electricity for that period. So that is it. I was just giving an advice, and I cannot judge whether it was fair or unfair. I will leave it to their own judgment. Right? The public accounts. Let me be very honest with you. I think you were there yesterday. That's why you asked this question. Just a little bit of education. Public Accounts Committee sits to consider Auditor General's reports, period. That is its function in Parliament. So if the Auditor General has not submitted any report on COVID expenditures, I can't go to Public Accounts Committee and say that I'm going to brief you on COVID expenditures until I'm invited. From time to time when COVID came, I was going to Parliament, the plenary, to brief my colleagues on how far we were fighting the battle. Okay? So at the appropriate time, now that Auditor General started doing auditing, especially within the World Bank group, when adverse reports come, or reports come and Public Accounts Committee call us, we will go there and explain matters to them. So take it that Public Accounts Committee works on Auditor General's reports, unless of course something different happens and the Speaker refers some matter to them. You can't just go. All I do is refer to my colleagues in the plenary from time to time. Nkoko, the hospital at Nkoko is a Christian hospital. Holy Family, it's a Catholic hospital, yes. The government has signed undertaking with the religious bodies. So we have a partnership agreement such that government supports them to also fill some gaps for us. You know, in health, we say that government cannot do it all. And in the past, we have government hospitals that couldn't go around the entire nation, up to living today, until this massive program of Agenda 111 started, which we haven't gone that far. So we support the Christian and Islamic hospitals by virtue of staffing. So we pay their doctors and their nurses and all that. So partially, it's government and the state and the church. Our health insurance tariffs give them a little bit upfront because they use their intelligent funds to do some expansion and things like that. So those who are going to a TB hospital, for some reason, if we are Accra here, some opt to go to Kolebu Polyclinic, some will go to Rage, some wouldn't stay here at all. We will go as far as to Legon, Achimote School. So it depends on patient discretion. And now it will be difficult for me to be able to tell why they will leave Nkoko Hospital to go to a TBA. My own hometown, we have a President Hospital in Doma Nkru. We have a Kale Hospital in Brekum. But people don't go to Doma. Some of them will leave Doma and come to hospital in Brekum. So that is discretion. But as to how, when government will set up another facility in Nkoko, it will depend on our demographics. When populations grow, when cities expand, the need for a second hospital, I think at the time, those in power will begin to look at how we can fix another facility at Nkoko. Emergency fund. We have an emergency fund in our constitution, but we haven't stuffed it that much. There are plans, especially with the establishment of the CDC. That will be a big thing to get ourselves ready for battle. And I think that fund, nobody will stop talking about it, will definitely be a feature of it. The update of the trust fund. Unfortunately, the trust fund sits outside the ministry's ambit, And I didn't anticipate this will come here. I'll get myself prepared next time so that I'll be able to give you some aspects of it. I think that's about all for now. So with your indulgence, Madam Moderator, I'll call the coordinator for Agenda 111 to come and just give us some little briefing on that. Thank you.
Honorable Minister, thank you for inviting me. Honorable Deputy Minister, Honorable Minister for Information, all protocols observed. I'm here just to give a quick update on the Agenda 111 program. Hospital Infrastructure Group are project managers for this project and work directly with the Ministry of Health and the Chief of Staff's office in coordinating this special program for the President. Now, the program has been divided into 8 zones. So there are 8 zones covering the entire country. And each zone has a supervising consultant who is responsible for the day-to-day supervision of works on the sites. These are 8 consulting firms. They are all Ghanaian consulting firms who were engaged to undertake this exercise. The program was announced in April of 2020. And since the announcement, a lot of work has gone into, first of all, identifying the sites. So the teams worked with the district assemblies and local traditional authorities in identifying suitable sites. One of the early things the team did was to set some criteria. So there were site selection criteria to help the district assemblies find suitable sites. Some of these include, say, distance to utility services, because if the distance from the hospital site to the nearest utility service is quite far, it impacts on cost. We also had to look at things like if the place is heavily forested, you have challenges with cost as well, because it means you must cut down lots of big trees and so on. We also had to make sure that there are no streams or water bodies and so on. And then we gave parameters on the gradient of the land, because as much as possible, you want to avoid very steep slopes that again impact on cost. So all these guidelines were provided, and there was an exercise to select these sites. Teams went around the whole country visiting these sites. Some of them were suitable, some had challenges, so we had to go back to the district assemblies to say, this site you've proposed, we think we will have challenges with that site, so can you give us an alternative site? That whole exercise took quite a bit of time. And finally, we got quite a number of sites which we thought were workable. In certain cases, they still couldn't find alternatives, because there are all kinds of local issues that require that the sites be in a particular place. So we eventually had to work with those sites. There are other areas where, as I speak, we still don't have sites for those locations, and those are primarily in Greater Accra. So for example, in the Nima area, we need 15 acres, and as you will agree with me, we cannot find 15 acres of land for that. So we are looking at some alternatives for the sites that have challenges, where there are no sites at all, I'm sorry. Another one that comes to mind is Adenta. As we speak, we cannot find 15 acres. The district assemblies are working on that, but haven't been able to give us any available sites. There are also some cases where the district assemblies offered the sites, but eventually then there are issues with the traditional authorities, and maybe the chief prefers it here, the district assembly prefers it there, and so that the team has to again work with them to coordinate and find an agreed settlement to be able to agree on a particular site for the neighborhood, the locality. As I speak, out of the 101 hospitals that were designated, 92 sites have been identified and are available for work. 41 of those had some challenges, and those are mainly to do with the terrain. So we've had to look at some alternative arrangements for that. 51 of those are fine. Processes have started. So as we speak, 63 of those sites have been cleared and are ready. There's a whole list. I believe that the Ministry of Information will furnish you with all the additional details. The contractors, the plan is to pay them some mobilization. So of their contract sums will be paid as advance mobilization. 138 of those have been paid. They are mobilizing to sites. Some have actually started work on site. I have a list of at least 10 sites that work has actually started, and quite a bit of work is going on. I'll touch on the psychiatric hospitals because I think the gentleman raised the issue. There are 2 psychiatric hospitals as part of the program in the Middle Belt and the Northern Belt. All the technical details have been completed, the drawings. We had to do soil tests for all the 92 sites that have been identified. We had to do geotechnical investigation, soil test, and also the topography. We had to send surveyors to all these sites to go and survey the sites and establish the topography and so on. So that has all been done. We're commencing very soon on the psychiatric hospitals. Also on the regional hospitals, we went through a tender process. The contractors have submitted their tender. It's being evaluated as we speak. And following from that, it will go through a value for money process, and all the commercial arrangements will go through Parliament and so on. Same applies to the Accra Psychiatric Hospital. So that's where we are. We believe that hopefully by the end of March, we'll have at least 67 of these sites that are working on the Agenda 101, the district hospitals. We'll have at least 67 by the end of March that are working. Each hospital has a completion time of about 18 months. So, and 18 months is from when the project starts for a particular location. So it's a staggered commencement and to be a staggered completion program. Honorable Minister, this is just a summary of where we are.
Thank you so much. So we'll take the last set of questions. I saw one gentleman at the back who wanted to ask a question. So if you still have a question, and then we'll take the lady here. If there are no questions, we will take these 2 and then wrap up. So please send the microphone to her.
Good morning. My name is Agnes from Chronicle. Please, I would like to get an update on the vaccination of pregnant women. I want to know how that is going, if they are availing themselves for them to be vaccinated. Thank you.
Thank you. Okay, so we'll take your question and that's it. Okay, I've seen a
Honorable, just for clarification's sake, a presentation on the breakdown of Government of Ghana 2021 COVID-19 expenditure, and then a total was 662 billion 541,104,053. I don't know if Selbetimi Maya for record's sake. Thank you.
Okay, so we'll take the last question. If you have a question, this is the time to ask, because after this round, we are done.
Yeah, my name is Vincent. I'm of a Daily Graphic. I also did not hear anything about the no vaccination, no entry. Should I say it's a policy or I don't know?
No vaccination,
No entry.
no entry.
Yeah.
Okay. You are talking about mandates.
Yes.
Okay. Okay, I think that's it. So on the vaccination of pregnant women and also the mandate, the Director General of Ghana Health Services here, maybe he would like to give us a comment. Then we go to the Honorable Minister for his final remark. So.
Thank you very much for the question. At the last review, that's when we added the booster and pregnant women. We can give you the figures for around Accra, but we're still compiling the total number of us. We don't normally pull them out, but after the last time, we had at least 1,000 pregnant women who had actually approached for half their vaccine done. And I think we will compile and give you the full update of the total number of pregnant women who have been vaccinated. We expect pregnant women to account about 1 million of the population, and so we will keep you updated. Thank you. And we'll talk about the mandate. We'll speak about the mandate. Yeah, thank you. On the issue of mandate, the minister said we'll give you update. And the essence of what we have been doing with the vaccine NIDs and the month of vaccination, etc., were all towards getting more people vaccinated. So announcement and its implementation will be based mainly on how people uptake the vaccine. In December, we recorded about 3 million doses as a vaccine month. We normally do about 1.5 million. We got about 3 million. In the last 5 days, as of Sunday, we had done about 1.5 million doses in 5 days, and we have extended because we had a target of 2.5 million doses. We will have this. So based on all that, the minister will decide whether it is time to come up with the mandate that will ensure that more people will get vaccinated. But as more people are vaccinating voluntarily, I don't think there's any rush to do that. Thank you.
Before the COVID expenditures, let me talk about the KNUST question somebody raised. The KNUST facility is not under the ambit of Ministry of Health. It is Ministry of Education. Understand they've started, and it looks like they are not being able to complete it. We sent proposals to the Ministry of Health to try and model it just like UGMC one. But we are at very early stages of discussing that engagement. So for now, if there is any question on its status or whatever, I think it will be better placed with the Minister for Education. Many are now COVID expenditures. I'm so interested. Midi can say, near Yadia Bahasino, a year near Sika helpful for, and yes, Pendy. Now, near my idea, no be, and a well banking, dear, well banking. Government. Now, donors, abrofu bilateral, multilateral donors, near my betty briar crown, and can we no crown? Ya 25 be no my is kakra, yet nina akika. Barcia, my breaking it down into bulk. PPEs. You can PPEs say, can we say? Edu baby no ya to we no kwa, especially with school reopening, over 30 million. Distribute across the entire country. Hospital bia obi abeko bia udru ho pese onya bi hye. Nti ese de bi ma obia. Medicines. Treatment centers no baby ani adi ni patoto nyina. Na ese yetuaka. Hospital equipments. Ese create ICU. Baby ICU ni kura no. hospital kitwe wo kitwe mu ese ye ready spend the sika to be si ho se be ya obi ba ye mfare ntukwane enko akiri kese. We were creating things overnight. Edu baby the hospital infectious disease center Ga East eko tutu monitors ne that the free kolebu share just to find some place for people to sit in. UGMC phase 1 ye I see you are near ho ye the overnight FT ho we the oxygen equipment yenya obi koto oxygen ne manu bi ye the produce oxygen what the machine no hyenye ye nipa free Korea buy within short time then they realize say you see be the manifold yes all pipe every machine no hospital ho. All hospitals in the country don't have these pipings. I say this ika yes man yen tumi Germany pa hu ntende ye beboka, right? So many things happened. IPC commodities test kits Noguchi yes at the beginning Niama ya test the COVID nebi ni hosa we have to buy and buy na ye donations esaneka ho enso na enso ye doctors nyina hia niama ya de bekatae ho. And look at the numbers we have to procure. Aprons, head gears, shoe fence, niama bebre ana yenibi. Bed sheets. Apart from hospitals, no treatments, no kra. When we started isolation centers, hotels, na ye ni patum nyina na ye free. Because the poraka so one fanis camera, obeka so nibi. Uja do so onko fie so a, or the yare no come na yira na nikunu. And ne manyina. Until we have to quarantine people. We were using soldier for to come on duty. Pentecost place. Onya kwani untunsuo. They gave it to us for free. We needed to feed beds, bed sheets, disposables. So all these things, for frame no, you have to find them because now you need emergency preparedness alert. Be I say, you was had never when you know Google baby. I didn't see ye kwakofaba. So we have to find money to pump in to avoid nipa EU. Moka said, baby, President can't say he knows how to fix the economy, but he doesn't know how to bring back people to life. Okay, that was the genesis of it. Because no one after ya don't know boyka. When just cannot swear, I may anya jumana ni peu. Until saw dia kukodru mampanyini. O ka che Ghana phone na se wonti mase. Na ka no de ebebo. Ba ye bo no ye save ye nkwa a ye chere se ye bewu na ye wosika. Why be this no? Nobody. So that is how come these expenditures. And so, what's American say huge. No be any budget is that. Nyame kra ni ma nya kwana. Yet me spend it. So that is it. Where no, me can say finance for kaya boy and kaya dear no. What you say? Yet this cannot be muma other ministries. We're doing so many things, other agencies. Even Nipa as I said, Bekasa, Nipa Nipa Tiasie, education, public education, any radio for adverts, your tone, baby. Yeah, you don't cry, yeah, Kunskana, near your machine. But if you don't go to do what you have to do with the money, Nipa Nguana, that is it. Minim say, Binum Betiasie, Binum soon Tiasie da. By the end of the day, just like I said, I cannot judge anybody's discretion. But the president was alert on the fact that it is better to protect the nation than to allow all of us to sunder. And that is the explanation to these things. Auditors are auditing. We are not seeing bad reports yet. But even if bad reports are bad, we will answer. And I don't think anybody will be found culpable of having spent recklessly or chopped COVID monies. As simple as that. Private sector individuals, they put up a whole place, 100-bed capacity, right? We supported them a bit with personnel. Now, amania you who you know, well, men who know what kind of ratras are. Some of us really suffered. Can't it no na doctor to me gina theater sa operations say binom time no na tia hwe me bo abode eno bi ne yehu ye no be 3 continuous days wa out office wa gina ICU wa wo ye do na binom nada because auto ha na afro case fufraba abwaje ye the papa we aba ha you have this year we were moving and down like in previous now sebio abodamfo. You see, but President Kai, or the more you are more you na idru ha Ghana for the Ibebu Nkonta, more accountability will definitely come. He was advising us on the way. So we are not surprised. By him say you are set your home aqua. Questions be you be to me answer. Isolation centers in Kwanka. Obi Kodel Hotel, be named some in social media so. Mr. Nigeria ni. Then ya say COVID kano, baby a Ghana for the NATO. Say no na hotel say bida. Hotel so cry no baby the COVID nipa kwa. Unyabi. Because nobody wanted COVID to come to their hotel. So we really suffered. But at the expense of the nation's coffers, we managed COVID. Them said luckily for us, success story explains the type of investments we made. So if you train your twasi, any po we are, and come in the same for so baso, Tisenia, Yaeno. Madam Wasibi. I spoke because the question was asked in Cree, so you should understand me.
So that brings us to the end of today's press briefing. Honorable Minister, distinguished ladies and gentlemen, thank you so much for visiting us this morning and for this very important conversation. I believe it's a starting point when it comes to health infrastructure and related matters, and I hope to see you some other time very soon. Thank you and good morning.
Anti-sense, anti-taste, yo, and do me dizzy. I warn in your code, and do me young, feel dizzy. Oh, papa, baby, you are say, baby, it's a way cook, nipa. You love way cook, human Africans in the grass and baba. Share, soldier Suro Corona, lawyer Osuro Corona, Malam Suro Corona, while I will pass the Osuro Corona. Corona, so who knows smiles is a look of Mama, who refuse to meet their social distance and weapon.